Slipped capital femoral epiphysis. This is a condition where the upper femoral epiphysis may get displaced at the growth plate, usually posteromedially, resulting in coxa vara. Coxa vara is angle between the neck and the shaft of the femur is reduced. That is, when the neck shaft angle is less than 120 degree. The slip occurs gradually in majority of the cases, but in some it occurs suddenly. This is seen in normal hip joint and this is seen in slipped epiphysis. Causes of slipped capital femoral epiphysis. The exact etiology is not known, but it is thought to be a result of trauma in the presence of some not yet understood underlying abnormality. It occurs in unduly fat and sexually underdeveloped, tall, thin, sexually normal children. Clinical features of slipped capital femoral epiphysis. Age. It occurs at puberty around 12 to 14 years. It is mostly seen in boys. It occurs on both the sides in 30% of the cases. There is definite history of trauma in some cases. It is common in patients with endocrine abnormalities. Presenting symptoms include pain in the groin radiating to the thigh and the knee joint. In the initial stages, the symptoms are due to sprain and are disregarded. They soon disappear only to recur. The limp occurs early and is more constant. Examination for slipped capital femoral epiphysis. The leg is found to be externally rotated and 1 to 2 cm short. Limitation of hip movements are seen, that is limited abduction and internal rotation with corresponding increase in adduction and external rotation. When the hip is flexed, the knees go towards the ipsilateral axilla. The muscle bulk may be reduced. Trendelenburg sign may be positive. Radiological features. On AP, that is anteroposterior view, the growth plate is displaced towards the metaphyseal side. A line drawn along the superior surface of the neck remains superior to the head, unlike in a normal hip, where it passes bisecting the head. This is called the Trethowans sign. On lateral view, the head is angulated on the neck. This can be detected early. Treatment for slipped capital femoral epiphysis. Treatment of an acute slip includes closed reduction and pinning as for fracture of the neck of the femur. Treatment of a gradual slip depends upon the severity of the slip present. If it is less than 1/3 the diameter of the femoral neck, the epiphysis is fixed internally, that is in situ. If the slip is more than 1/3, a corrective osteotomy is performed at the intertrochanteric region. Treatment of the unaffected side in unilateral cases. Since the incidence of bilateral involvement is 30%, prophylactic pinning of the unaffected side in a case with unilateral slip is justified.